Okay, hi, I'm Jenna, I'm the Minimalist Doula, and I thought I would try and make a very short video to give you 5 top tips if you're considering a home birth. One of my friends is currently considering a home birth, and I was thinking about what I would tell her, and I actually attended one last week, so it's very, very fresh in my head. So my first top tip would be think about directly afterwards, because once baby's out, obviously, mum is a bit shocked, overwhelmed, ecstatic, many emotions, just giving birth, exhausted, exhilarated, but generally a bit out of it. So I would say have things right there. You're not planning on going to hospital, but maybe pack the bag so baby stuff is there, nappies are there, maternity pads, pants, soft clothes to put on. If you're having a water birth, have a big dressing gown ready for when you get out to keep you warm. But just think about that bit kind of right after baby's there, because often, lots is going on, more than you think. It's not kind of always that kind of calm first golden hour. Things are happening. And it's nice if things are just within reach. So that would be my first top tip. My second top tip would be that if you are having a water home birth, to definitely do a run through. Because I think in the moment, the last thing you or dad or your birth partner or whoever's with you wants to do is kind of do something for the first time. So, check your tap connectors, check your hose is long enough, check it all kind of fits, the dynamics of it, where are you going to put it, do you like the view wherever you are, can you put your affirmations around you if that's what you're doing. But I would definitely suggest having a run through of the pool, especially because sometimes they're punctured. I don't want to freak anyone out, but sometimes they are, and it's a very quick fix, but obviously you want to know that at the time and not when you're in labour. So water birth, definitely have a run through, I would suggest. And it doesn't take that long. You don't have to fill the pool necessarily, or you can. Okay, so top tip number 3 is, I would say, it's a few things you probably don't need at home birth. There's big, huge lists that probably seem a bit overwhelming. And you can manage with very little. But what I would say you definitely need is lots and lots of towels. I didn't really get that. I was like, why do you need so many towels? Surely, it's just you and baby, whatever. But you just need them. There's never enough. Baby comes out, you want a couple like immediately over baby just to keep them warm. You might want a couple around your shoulders. If you've been in the pool, you need even more. Water seems to get everywhere. Obviously other fluids and blood and things like that. You just seem to need lots, and it's good to have a huge stack, so whatever you need, however many get used or ruined or whatever, there's always more, so you're not kind of scrabbling around for towels. So I would say have way more than you need and have them really close by, so they're just there, because it's so easy in the heat at the moment to go and get the best towels out, which my hubby did. So yeah, I'd say towels. Top tip number 4, I would say, is don't worry about it. I think some people who go for a home birth really want one, but then there's other pressures and concerns and worries. I mean, if you're fairly close to a hospital, which lots of people are these days, you can basically think of your home as a birth centre. The birth centres have midwives, only some pain relief options, just like you do at home. And I would say, it's okay. If you're feeling worried, you can change your mind. You can change your mind whenever you want, either way around. And, if you're in a hospital, even better. You basically consider yourself like you're in a birth centre. Paramedics can be there within minutes. Your midwife will be on hand. They will have a lot of equipment, like a resus kit and all that kind of thing, that they can do a lot at home. So if you are considering a home birth but you still have worries, you can change your mind, and there is a lot of facilities there for you to feel safe. And if it wasn't safe, They just wouldn't allow it at all. So I would say go to the evidence, look at the stats. You know, second-time mums are safer at home, statistically, and first-time mums are only slightly more at risk first time. So yeah, definitely look at the evidence, and don't stress about it, and just think about where you're going to feel safe. And number 5 is enjoy it. I mean, you're at home. You can do whatever you want when you want. You can eat, you can drink, you can dance, you can watch Friends reruns. You're in your space. It's your birth. You can listen to your body. No one's going to be interrupting you. You can have the dim lighting, the candles, the beautiful affirmation wall. You can look at special pictures. You can rock on your birth ball. You can find your corner or nook of a room that you feel comfortable in. You can do whatever you please. And often in that situation, uninterrupted and undisturbed birth is very successful. And it will unfold beautifully, and it will unfold naturally, and it will be what you hope it to be.